sending toys with lead paint into our country, we have a weaker bargaining position because everybody ever tried to negotiate with their banker? It's hard. If you owe somebody money, they've got the upper hand on you. So, if we get our energy policy right, not only can it help us save our environment and global warming, not only can it help your pocketbook, but it will make America stronger. And it is one of the top priorities of an Obama administration.
Senator Obama, I have a 24-year-old brother that served 2 terms in the Iraq War, and as a Marine, he has come back to the Indian reservation on Navajo and is suffering from PTSD like many of our veterans. And as a Native American physician who cares for Native patients, first of all, 2 issues are going on. The healthcare coverage for our Native people is underfunded through Indian Health Service. And we need people like you to really make a difference, to really step up to the sovereignty between our Indian countries. So what do you plan to do in terms of the health care issues with our Native people and in terms of taking care of our troops who are suffering from PTSD and ultimately, taking their own lives, as we heard from a report just the other day?
Yeah, well, these are great questions, and we appreciate your service as a physician in Indian country. There are really 3 parts to your question. So let me break them into 3 parts. Part number 1. My job as Commander-in-Chief will be to keep the American people safe. That's my primary job. But I can't do that job if I'm not looking after the troops who we ask to serve. And we have a solemn obligation to serve them, not just when they're fighting the war, but also when they come home. We should have zero tolerance for homeless veterans. We should be giving them the services that they deserve. It is a scandal how we've treated our troops in the past. That's something we can still get right about this war. So, I've already been working on this issue. One of the things that we need to do is to have screening of every single troop that's discharged. Not just for physical wounds, but for post-traumatic stress disorder or brain trauma. And we have to give them the mental health services that they deserve. We should not be shortchanging them. That is going to be a top priority in an Obama administration. That's point number 1. The second point that you raised has to do with what are we doing about Indian Health Services. I have been a big proponent of increasing funding for Indian Health Services. I will do so when I'm President of the United States. We've got to get more money into the system. And part of what we have to do is make sure that Indian Health Services is doing what our healthcare system as a whole needs to do, and that is emphasize prevention. So many of the problems that Native Americans face are treatable illnesses. Obesity, substance abuse, diabetes, asthma, a whole host of these issues are issues that you see the same thing in the inner city among African Americans. You see the same thing among Latin Americans. You're seeing it increasingly among our children. If we are helping people with regular checkups, regular screenings, we've got primary care doctors, then we will actually save money on the long term because people will be healthier. If we give substance abuse treatment programs, then we will save money and people will be healthier. So we've got to emphasize prevention. So we've got a health care system, not a disease care system, which is what we have right now. That's point number 2. And point number 3 is, this is a crisis that is obviously more severe in Indian country, which is why it's so important also for us to get more people like yourselves, more doctors, more nurses into these communities. And that's why I want to give scholarships. That's part of our national service bargain, both for teachers and for physicians and nurses. If we can get them into these communities, we will give them full scholarships if they make full commitments to work there. But what we need overall is a healthcare system that makes sense. We spend more money on healthcare than any nation on earth. It's not even close. And yet, the French are more satisfied with their system and they're healthier. The Canadians are more satisfied with their system and they're healthier. And we don't have to have a national healthcare plan just like Canada's. What we do have to have is a universal healthcare plan. So what I've said is this. If you've already got healthcare, we are going to work with your employer to lower your premiums by up to $2,500 per year. By putting in a catastrophic reinsurance plan that helps lower premiums. If you don't have healthcare, then you will be able to buy into a healthcare system that's similar to the healthcare plan I have as a member of Congress. You'll still be able to choose doctors. You won't be excluded for pre-existing conditions. If you can't afford it, we will subsidize you, and we will regulate and crack down on the insurance industry and the drug companies so that they are being more reasonable in terms of how they operate. But let me tell you the truth, though. Every presidential candidate, every 4 years, promises health care reform. And it doesn't happen because the special interests dominate Washington. The only way I'm going to be able to deliver on health care reform is if the American people give me a mandate to change, and if they are paying attention and watching Congress when we have these debates next year, so that you are holding your members of Congress accountable and they're looking after you instead of looking after the drug companies and the insurance companies. I'm going to need your help. I'm going to need your help. All right. Let the guys turn. Let the guys turn. This gentleman in the red shirt right here. Hold on, sir. We got a mic coming.
Senator Obama, I want to go back to your energy policy once again.
Sure.
Would you be a proponent of other nations that are using alternative energy sources or nationalizing their energy? Would you be a proponent of having a nationalized energy policy or a privatized energy policy?
I don't think that we need. I don't think we need a nationalized energy policy. I think that I believe in the free market, and I think that one of the great and powerful things about America is the ingenuity and entrepreneurship and innovation that helps to move our economy forward. So I would want to maintain. I would want to maintain that, but what I do want to do is to provide the regulatory structure and the incentive structure so that the private industries are making good decisions. Let me give you a very simple, specific example. It has to do with global warming. Right now, utility companies, they can pollute and send up greenhouse gases as much as they want, and that doesn't affect their bottom line. And if it doesn't